Hello, and welcome to this video. It's a part of our deep dive series, and today we're looking at spirituality in aged care. So spirituality is a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence and experience a relationship to self, family, others, community, society, nature, and the significant or sacred. Spirituality is expressed through beliefs, values, traditions, and practices. Now, this is a quote from the National Guidelines for Spiritual Care in Aged Care that was developed by the Australian Government in 2016. And underpinning the guidelines is the philosophy that the spiritual dimension is intrinsically human. I think that's really important to remember and needs to be recognised and respected as sacred. And therefore, spiritual care is a basic human right, and all older people receiving care should have access to effective care in a way that's meaningful to them. This is a picture of the cover of the National Guidelines for Spiritual Care in Aged Care, and there is a link to the website. You can, if you can't access the link, you can just go and Google it. It will come up easily, and you can print out your own copy. So the National Guidelines for Spiritual Care and Aged Care were developed in 2016 to guide healthcare providers on the topic of spirituality. So what is it? What is spirituality? It has at times been taken to mean adherence to religious practice, but I think it's more than that. Certainly for some, this is so. However, for many others, spiritual issues are raised as they're approaching death, and they're expressed as questions such as, what was my life all about? And what is the meaning of suffering? It is a difficult concept to describe adequately, but in general terms, it refers to the intrinsic notion of the self and the meaning-making system of the person. I think that's the most important thing to grasp. And as the guidelines put forward, it is at the core and essence of who we are, that spark which permeates the entire fabric of the person and demands that we are all worthy of dignity and respect. It transcends intellectual capability, elevating the status of all humanity to that of the sacred. So you can see by this particular definition that the idea of God is not mentioned at all, and nor is religion. So people may not use the word spirituality, and some may not even want to discuss this with you. So it is worth screening clients prior to going into a thorough assessment. There are a few more notes on spirituality, on what it is, and these are also taken from the guidelines. Now, it might be a good time now for you to stop this video and spend a minute considering, given what you've just heard, on what your definition of spirituality is for you. So as we've seen, it is an intrinsically human characteristic, so you do possess it. You have spirituality. Exploration of this topic for yourself will surely bring about a more holistic approach to your vitally important work caring for our aged population. We can't say we are caring for our residents fully unless we can address all their care needs, including care of their spirit. Some would argue that that's the most important thing. And I would add here that you are no doubt already doing this, but maybe not recognizing it as spiritual care. So my ultimate point is, don't be put off by the term and have a go. Spiritual distress can show up in different ways. Be on the lookout for any behaviours or expressions which may not fit with the usual for your resident. This may be a sign that they are struggling with some inner demons. Don't fall into the trap of thinking that because people are old, things don't matter to them, or that they don't experience deep emotions relating to their current situation or to events in the past. You don't have to be a fully trained counsellor to sit with someone and allow them to express what's on their mind. You may be the only one they have to talk to. Dementia can actually precipitate an opening of thoughts and feelings long held under control, but now they flow freely. This can be pretty confronting and scary. There may be a lack of being able to make sense or organise these jumbled thoughts. It's also well documented that as people approach the end of their lives, there may be an inner knowing and a desire to sort through, kind of like a life reflection. It might be that you are the best person to be present for this process. And as I've said before, it might be that you are the best person to be present for this process. Sometimes family are too close, feelings still too raw, hearts too broken. What an amazing opportunity you are being handed. Attempting to control suffering by regarding it as a physical state amenable to treatment is inappropriate. It will be tempting, in the interest of time and maybe even your own discomfort at seeing a resident who is distressed, to reach for the medication chart. Time to stop and prop. Encounters with the dying can be life-changing moments for us as carers. Don't let these moments pass you by. Probably the most important thing you can do is stop and listen and try and find just a tiny bit of time in your busy day. As spirituality is intrinsic to being human, questions of a spiritual nature may arise anytime, and therefore spiritual care is everyone's business. As healthcare workers in contact with older people as part of your work, we need to have a basic awareness of spirituality and how it affects our role. The level of knowledge and skills relating to spiritual care should be commensurate with your role, responsibility, and amount of contact you have with older people. There is a distinct role for spiritual care practitioners, such as chaplains, pastoral carers, and pastoral care practitioners, but you can act as an important conduit and advocate for those in your care. You know a lot more than you think. After all, you are human. One way to assess someone's spiritual needs is to use the HOPE tool. And that's an acronym for Hope, Organised Religion, Personal Spirituality and Practices, and Effects on Medical Care and End-of-Life Issues. So you can find that online. How can I provide spiritual care? So some people will need more support and may want to talk to you about their spiritual concerns. So encourage the person to explore their worries and fears. Listen without passing judgment or dismissing their concerns. Try to understand and listen to your residents' beliefs without imposing your own. If you don't feel comfortable having these conversations, ask an experienced colleague or a specialist, such as a chaplain, to be involved. And then, if you have the time, be present as well so you can learn from them, and then you will feel more comfortable next time someone asks you to sit and listen to them. Questions about life and its meaning are very complex, so don't feel you always need to have the answer. Leave room for listening, thoughtfulness, and stillness. You can also encourage your resident to find their own coping techniques, such as, especially ones that have worked for them in the past. This may include doing things they enjoy, writing down thoughts and feelings, and finding ways to relax, such as listening to music or having a massage. Some people may find it helpful to find out more about how they're feeling for themselves, and there are a number of publications available for that as well. You can access further support through counselling or specialist palliative care service or a social worker, but you'll need to go through the normal channels for your facility. And very important that you take good care of yourselves. This is a difficult space to be working in. It's been incredibly demanding and stressful, particularly over the last few years, now that I speak to you in 2022. And I know everyone's talking about self-care, but it really is such an important part of our work as we work with aged residents. Caring for people with a terminal illness can be very demanding. It might prompt you to ask questions about your own mortality, your beliefs, and look for meaning and purpose in your own life. So take time to look after your own spiritual well-being. Spiritual self-care can involve spending time with family and friends, meditation, physical activity, reading, spending time in nature, and following religious practices. If you're struggling, you might find it helpful to speak to your manager, a counsellor, a psychologist, or a faith leader. And here is our resources page. You can stop on that and take note of different resources that may support you in your practice of taking care of our aged residents. And here endeth the lesson. Thank you for watching this video and stay tuned for the next one. Take care.